Hi there, my name is Kayla. I'm a master's student in bioengineering, and I work with the Techie Center on campus run by Dr. Carla Pugh, who is in the Department of Surgery. And on behalf of my team, I'm here to talk to you today about our work surrounding establishing procedural metrics for scoliosis bracing. So we primarily collaborate with Grant Wood, who is an orthotist at the Align Clinic in San Mateo, as well as Dr. Voorhees, who is a pediatric orthopedic surgeon. So scoliosis, or more formally adolescent idiopathic scoliosis, involves deformity of the spine. So this affects about 2 to 3% of people, and it's estimated that about 38,000 children are fit for a brace every year. So without effective treatment, scoliosis can progress to more severe curvature and require invasive spinal fusion. So standard non-operative management is to design custom fit rigid orthosis, more commonly known as a scoliosis brace. So here at the Techie Center, we see a lot of room for improvement here, namely traditional braces and bracing techniques. The design of braces is largely qualitative and just relies on a visual inspection of the in-brace x-ray. So once you take an x-ray of how the brace changes the location of the spine and corrects that curvature, they can do some kind of quantification of the angles and how much the angle of the curvature is improved. But we really believe that if we could add other metrics, namely pressure and an understanding of where pressure is being applied in these braces, we could begin to get a spatial understanding of the forces that are present, the magnitude of those forces, and how they're being applied to the body. So, like I had mentioned, evaluating the brace is just this two-dimensional understanding of how the curves are being improved. However, there's actually also a three-dimensional component. There's a rotation of the spine that will often occur for scoliosis patients, and you just really can't get an understanding of if this correction is being implemented for these patients. So by pressure, being sensitive to the pressure in these braces, we could begin to get a three-dimensional understanding of the forces at play and how this is able to correct the spine. In addition, current traditional bracing, the duration of bracing is highly variable, sometimes ambiguous, how long the patient needs to wear the brace or for how many years. But we believe that by bringing an objective understanding, we could begin to know how long the patient needs to be braced and for how long and at what point it would become unnecessary. And in addition, we believe that we could improve the success of these braces. So improve outcomes from any of these metrics that I have described here that could hopefully improve the success of getting these patients' spines corrected. So the method and approach that we're taking that I kind of alluded to was this idea that we could sensorize the brace and place a pressure sensitive material inside that could begin to give us understanding of the forces at play in 3D to improve the outcomes for these patients. So it's all based around a fabric that changes electrical property as it's pressed. Namely, we create this sandwich of fabric. So we put this pressure sensitive fabric in the middle, and then we create this hash pattern on the top, on the either side of the sandwich, horizontal electrical connections and these vertical electrical connections that where they overlap with the resistive fabric between. That overlapping region is where we would be able to recognize the pressure and measure the pressure. So the idea is we would create this hash pattern with the sandwiched resistive fabric and then line the brace with this and then be able to get a readout of pressures at play. So this is something we would be developing in-house, and I'll go into a bit more in the results section about where we're at with that. But we decided to begin with just a sensor that's available in industry. This one namely is from BodyTrack, that will allow us to first get an understanding of where the pressures are across the entire torso to know where we really want to hone in on and really track how the pressures are changing across the child's treatment. The great thing about this is we can get a quick understanding just using this sensor from industry, and it has software that visualizes the pressures. However, it's not as conformable as we would like. It really can't bend to all the curvatures of the brace and prevents proper fitting. In addition, it's rather expensive, so we just saw a lot of room for improvement here by creating our own in-house sensor. So some great things about the design that we've got: it's sweat and waterproof. We've not only got the 3 layers that I described here, but then on either side, we also have 2 layers of Tegaderm. Then in addition, the sensor is very responsive in the region of the pressures from former literature that we know scoliosis bracing would have. So namely between 0.9 and 1.6 PSI. And we can see that the sensor here, as we were calibrating it, really shows a linear response to the force loading. And also we created this large pressure sense array that can wrap all the way around the body to give us that pressure map that I was describing before, so that we can get an understanding of where the pressures are and really hone in on those areas to track how the pressures are changing throughout treatment. So in conclusion, we really believe that an understanding of the pressure metrics could confirm spatial understanding of the pressures being applied to ultimately augment a clinician's understanding of the 3D mechanics of spinal correction that are going on. Hopefully we could then guide bracing duration and ultimately improve outcomes for these patients. So future directions, after we finish the calibration and hysteresis testing of our in-house sensors, we'll be doing some patient observation this summer. We'll be collecting the range of pressures from various different bracing techniques, the Boston brace, Rigaud-Chanel, Providence nighttime bending brace, and then identify common regions of interest and pressure hotspots that we would want to study longitudinally across the child's treatment. Thanks for taking a listen, and happy to answer any questions if you get in touch over email. Thank you.